I'm Sarah Senganda, and I'm the clinical nurse manager. I've been working in this unit since May 2010. There was no privacy at all. Imagine asking them about their life just in the middle of the corridor. We worked on it and we said, okay, they will be assessed in Angel Suite, which is next to CT scan. When we are still seeing patients within an hour, we had a problem whereby there was no plan at all. Everybody, I think, was doing their own thing. It was really in a mess. It was really in a mess. But since then, we are working together as a multidisciplinary team. The city team are involved in a stroke. We get the first priority. When you get a patient to be thrombolyzed, straight away you take the patient to the city. That one also helped us to get the target, to beat the target of 30 minutes. And we work alongside also with NE. How NE are really helping a lot. In case you get, sometimes we get like 7 blue calls. But NE also helps and assess. We've got a lot of band 6s, and we've done a lot of training which has helped us to improve, make us to be where we are now. Privacy and dignity is really maintained by educating staff, trying to tell them that, okay, in case the patient comes in, there is something like that, we can push the patient straight to the CT scan and we could assess, just to maintain privacy, we could assess the patient maybe by the CT scan rather than doing it in a corridor straight away. Some of the doctors were really resistant, just saying that this needs to be done there and then. But the band 6s were very good. We are challenging them and saying, no, can we try and do this somewhere else? It helped, it really helped. And we came up with that Angel Suite, the Angel Suite which I told you about, whereby we are able to assess patients there and we beat the target and make sure the patients are being thrombolyzed within 30 minutes. We've had a lot of feedback which we've put on the board. When you walk in the unit, you could see all the feedback. Yes, they say they were rushed, but they are glad that they were rushed and they were seen within that time. No one came up with any problem that their privacy or dignity wasn't maintained. We get really a lot of feedback, and you could see with our results where we are now that we are the best in the country. If there is no teamwork, nothing can work. The doctors need to work with the nurses, the therapists, radiographers, everyone needs to work together as a team. By asking the nurses the problems they are facing, and we work on it, because every patient comes in with different problems. If they say this and this, something new to us, which we've never faced before, we are able to deal with it, or make sure that we send emails, feedback that this and this happened on this day, but next time, in case this is the way we are supposed to do it.